Magnesium. 4 times you should avoid it and 5 signs you may need it. Nearly half of all Americans fall short on magnesium intake every single day. That statistic comes straight from the National Health and Nutrition Examination Survey, which found that 48% of Americans across all age groups consume less magnesium than their bodies require. And some researchers put the number of adults not meeting average dietary intake as high as 60%. But here's the thing about magnesium. While millions of people walk around deficient in this mineral, certain situations exist where taking magnesium supplements can turn dangerous, even deadly in some cases. Today we're covering both sides of this equation. We'll start with 5 signs that your body might desperately need more magnesium, then examine 4 situations where you should stay away from magnesium supplements entirely, or at minimum approach them with serious caution. This isn't about pushing supplements or scaring anyone away from them. The goal here is understanding one of the most overlooked minerals in human nutrition, and knowing exactly when it helps and when it harms. First up, why magnesium matters so much in the first place. Your body relies on magnesium for over 300 enzymatic reactions. That number isn't hyperbole. It directly participates in protein synthesis, bone formation, blood pressure regulation, nerve function, and the electrical signals that keep your heart beating properly. Consider all the systems that depend on this single mineral. Your heart needs it, your muscles need it, your kidneys and bones need it too. Roughly 50 to 60% of your body's magnesium sits in your bones, another 40% or so fills your muscles and other tissues, and only about 1% circulates in your blood. That last detail creates real problems when doctors try to diagnose deficiency, which we'll discuss later. The recommended dietary allowance for adults lands at 400 to 420 milligrams daily for men and 310 to 320 milligrams for women. Pregnant women require a bit more, around 350 to 360 milligrams each day. The problem shows up in what people actually eat. The standard American diet, loaded with processed foods and light on vegetables, nuts, and whole grains, simply fails to deliver adequate magnesium. U.S. Department of Agriculture data shows the average woman consumes only 228 milligrams per day, while men average about 323 milligrams. Both figures fall below what most bodies require. The situation appears to be worsening over time. Estimates suggest that mineral content in vegetables dropped by 80 to 90% over the last century, thanks to modern farming techniques, depleted soil, and the dominance of processed foods in our diets. Part 2. 5 signs you may need magnesium. Sign number 1. Muscle twitches, cramps, and spasms. This symptom tops the list of recognized magnesium deficiency indicators. Anyone who's dealt with an eyelid twitch that won't quit, leg cramps that jolt them awake at night, or random spasms in their hands and feet knows how frustrating these sensations become. Medical literature describes these as fasciculations, brief spontaneous contractions that affect a small cluster of muscle fibers and create that flickering movement visible under the skin. Tremors, poor coordination, and tetany, which causes involuntary and painful muscle spasms, also show up on the symptom list. One clarification matters here. Muscle twitches stem from many causes, including stress, excess caffeine, and certain medications. But persistent unexplained muscle issues should put magnesium deficiency on your radar. The underlying mechanism involves magnesium's role in muscle relaxation. Calcium triggers muscle contractions, while magnesium enables muscles to relax afterward. When magnesium runs low, that balance breaks down, and muscles become overexcited, twitching and cramping without any input from you. Sign number 2. Mental health changes. This connection surprises many people. Research links magnesium deficiency to mental health struggles including apathy, that sensation of mental numbness or emotional flatness, along with depression and anxiety. A 2023 systematic review examining randomized clinical trials uncovered an association between magnesium supplementation and improved depression symptoms. Another review from 2024 found benefits for people dealing with mild anxiety and insomnia. The link makes biological sense once you understand that magnesium participates in neurotransmitter function and helps regulate how your body responds to stress. Bodies running low on magnesium experience stress more intensely, and brain chemistry may not operate at full capacity. None of this means magnesium cures depression or anxiety, since mental health involves far more complexity than any single mineral addresses. But mood changes appearing alongside other symptoms on this list justify investigating your magnesium status. Sign number 3, fatigue and weakness. Persistent, unexplained fatigue marks another classic deficiency sign. This goes beyond normal tiredness after a demanding day. We're talking about deep chronic exhaustion that sleep doesn't fix. The explanation connects directly to energy production inside your cells. Many of those 300+ enzymatic reactions we mentioned convert food into usable energy. When magnesium supplies run short, these energy-generating processes slow down considerably. Low magnesium also disrupts potassium levels in muscle cells, contributing to feelings of weakness. Activities that used to feel easy suddenly become struggles, and minimal exertion leaves you depleted. Early deficiency signs include not just fatigue and weakness, but also appetite loss, nausea, and vomiting. These vague symptoms get attributed to countless other causes, which partly explains why magnesium deficiency flies under the radar so often. Sign number 4, irregular heartbeat. Deficiency enters dangerous territory with this symptom. Heart arrhythmia, meaning irregular heartbeat, represents one of the most severe consequences of low magnesium levels. Research reveals that low serum magnesium correlates with up to a 50% higher incidence of new atrial fibrillation. Low magnesium also serves as a significant predictor of sudden cardiovascular death and overall mortality. Those findings deserve serious attention. Magnesium regulates how electrolytes like sodium, potassium, and calcium move within your heart's tissues. These electrolytes maintain normal heart rhythm. Deficiency disrupts that regulation, and rhythm problems follow. Some people notice palpitations, that unsettling flutter in the chest. Others detect nothing until bigger problems emerge. Low magnesium also correlates with elevated risk of coronary artery calcification and cardiovascular mortality. Sign number 5, high blood pressure and cardiovascular issues. This sign connects directly to the previous one. Low magnesium increases vascular tone, which aggravates high blood pressure. Worsening deficiency brings numbness, tingling, personality changes, abnormal heart rhythms, and even coronary spasms. Severe deficiency can throw off your entire mineral balance, causing calcium or potassium levels to plummet, each creating its own cascade of problems. The cardiovascular connection appears throughout the research literature. One paper labeled Subclinical Magnesium Deficiency, a principal driver of cardiovascular disease and a public health crisis. That's strong language backed by solid data. Before we cover when to avoid magnesium, one obstacle deserves attention. Diagnosing magnesium deficiency poses genuine challenges. The core issue involves where your body stores magnesium. More than 99% sits inside cells and bones, with less than 1% floating in blood serum. Standard blood tests only measure that tiny fraction, which means normal results can coexist with cellular-level deficiency. Normal serum magnesium falls between 1.46 and 2.68 milligrams per deciliter. Researchers call the absence of a standardized test that accurately reflects magnesium status one of the most frustrating challenges in the field. Deficiency often goes undiagnosed, partly because symptoms don't appear until levels drop severely, and standard tests miss subclinical deficiency entirely. The practical implication for you is that symptoms matter. Experiencing several signs we discussed, especially while falling into high-risk categories like diabetes, gastrointestinal diseases, or alcohol dependence, means you shouldn't assume everything is fine just because blood work came back normal. Before examining the 4 times to avoid magnesium, we need to identify who faces the highest deficiency risk. Certain groups experience significantly higher rates of inadequate magnesium intake, including people with gastrointestinal diseases like Crohn's disease or celiac disease, people with type 2 diabetes, those dealing with alcohol dependence, and older adults. People taking proton pump inhibitors, those acid reflux medications like omeprazole or lansoprazole, also face elevated risk. The FDA issued a specific warning about this, stating that prescription proton pump inhibitors may cause low serum magnesium when taken for prolonged periods, typically longer than 1 year. One detail from the FDA review stands out. In approximately 1/4 of cases, magnesium supplementation alone failed to restore normal levels, and the PPI required discontinuation. In 2009, roughly 21 million patients filled PPI prescriptions at outpatient retail pharmacies across the United States, which represents a massive population facing this risk. Long-term PPI therapy makes this conversation with your doctor unavoidable. Now for the flip side. Magnesium deficiency affects many people and causes real harm, but specific situations make supplementation dangerous. Here's what you need to know. Situation number 1. If you have kidney disease or impaired kidney function. This situation carries the most risk. Your kidneys serve as the primary regulators of magnesium levels. Healthy kidneys filter out excess magnesium and eliminate it through urine, which explains why healthy people rarely develop magnesium toxicity. But impaired kidney function disables this safety mechanism. In moderate chronic kidney disease, kidneys can still compensate somewhat by increasing the percentage of magnesium they excrete. That compensation fails in advanced kidney disease, specifically when creatinine clearance drops below 30 milliliters per minute. Overt hypermagnesemia develops frequently in patients whose creatinine clearance falls below 10 milliliters per minute. End-stage renal disease patients often show mild hypermagnesemia even without supplementation. Magnesium-containing medications like antacids or laxatives push them toward dangerous territory. The research leaves no ambiguity. Renal failure causes decreased magnesium excretion, which leads to toxicity, and patients with reduced kidney function require close monitoring of magnesium levels. Hypermagnesemia, meaning excess magnesium in the blood, affects approximately 10 to 15% of hospitalized renal failure patients. Severe cases cause respiratory paralysis, cardiac arrest, and death. Kidney disease of any kind means no magnesium supplements without explicit guidance from your doctor. Situation number 2. If you have certain heart conditions, particularly heart block. This seems contradictory at first glance. Earlier we covered how magnesium deficiency causes heart problems, so supplementing should help, right? Not always, and the answer depends entirely on which heart condition you have. Magnesium functions as a natural calcium blocker and affects how electrical signals travel through heart tissue. Some conditions benefit from this effect. Others, particularly heart block or damage from a myocardial infarction, become more dangerous. Excess magnesium causes bradycardia, meaning abnormally slow heart rate, along with hypotension, prolonged PR interval, prolonged QRS interval, prolonged QT interval, and complete heart block. Extreme cases progress to cardiac arrest. At elevated serum concentrations around 6 to 12 milligrams per deciliter, ECG changes appear, including prolonged PR interval, widened QRS complex, and increased T-wave amplitude. Deep tendon reflexes vanish as magnesium approaches 12 milligrams per deciliter. Cardiac arrest becomes possible when blood magnesium exceeds 15 milligrams per deciliter. Clinical guidance recommends that people with pre-existing heart conditions, especially heart block, approach magnesium supplementation with extreme caution. High doses, particularly intravenous magnesium, require avoidance in patients with heart block. Any heart condition warrants a conversation with your cardiologist before starting magnesium supplements. Situation number 3. If you have myasthenia gravis. This information could save lives, yet many people and even some healthcare providers remain unaware of it. Myasthenia gravis is an autoimmune disorder where the immune system attacks nerve-muscle connections, causing muscle weakness and fatigue. Magnesium worsens this condition dramatically. The mechanism involves magnesium's effect on acetylcholine release at the neuromuscular junction. Acetylcholine serves as the chemical messenger enabling nerves to communicate with muscles. Myasthenia gravis already impairs this communication, and magnesium suppresses it even further. Medical literature presents this clearly. Magnesium sulfate use is contraindicated in myasthenia gravis patients because it can trigger myasthenic crisis. a life-threatening condition involving neuromuscular respiratory failure. Documented cases exist of myasthenia gravis patients developing severe muscle weakness, breathing difficulties, and respiratory failure after receiving magnesium, sometimes at serum concentrations healthy individuals tolerate without issue. One case report describes a 62-year-old woman with myasthenia gravis whose condition deteriorated dramatically after standard intravenous magnesium replacement. Her respiratory failure worsened to the point of requiring intubation, mechanical ventilation, and extended intensive care. The Myasthenia Gravis Foundation of America lists magnesium as potentially dangerous when given intravenously, recommending its use only when absolutely necessary, with careful monitoring for worsening symptoms. An important distinction exists here. Intravenous magnesium administered in medical settings poses the greatest threat. Small amounts from food generally cause no problems, and usual doses in daily multivitamins unlikely cause issues for most patients. Myasthenia gravis patients should never take magnesium supplements without neurologist consultation. Hospitalization for any reason requires informing your medical team about your diagnosis, since awareness of this interaction varies among providers. Situation number 4. If you're taking certain medications. Magnesium interacts with a surprisingly broad range of medications. Some interactions merely inconvenience you by reducing medication effectiveness. Others create genuine danger. Antibiotics present the first category of concern. Magnesium, calcium, and zinc interfere with gastrointestinal absorption of certain antibiotics, especially tetracyclines and quinolones. Taking these together causes magnesium to bind with the antibiotic in your gut, forming complexes your body cannot absorb. The antibiotic loses effectiveness, and your infection may persist. Timing offers the solution. Take these antibiotics at least 2 hours before or 4 to 6 hours after magnesium supplements, and apply the same rule to magnesium-containing antacids. Bisphosphonates. Medications treating osteoporosis face similar absorption problems. Magnesium decreases bisphosphonate absorption when taken together, reducing their bone protective effects. Avoid magnesium-containing products within 2 hours of taking oral bisphosphonates. Blood pressure medications demand caution as well. Magnesium naturally lowers blood pressure, and combining it with pressure-lowering medications, particularly calcium channel blockers, risks dangerous blood pressure drops. Magnesium disrupts calcium movement through calcium channels and amplifies synthetic calcium channel blocker effects. Levodopa and carbidopa, Parkinson's disease medications, also experience reduced effectiveness when combined with magnesium oxide. Patients taking levodopa and carbidopa should avoid magnesium oxide entirely. The bottom line applies broadly. Regular use of any medication requires checking with your doctor or pharmacist before adding magnesium supplements. They can spot potential interactions and determine whether supplementation makes sense, including how to time doses appropriately. Understanding the warning signs of excess magnesium could save your life or help you recognize danger in someone else. Early toxicity symptoms stay relatively mild, including diarrhea, nausea, vomiting, muscle weakness, and low blood pressure. These same effects appear even at normal supplemental doses, so they don't always signal toxicity. Loose stools commonly occur when people start taking magnesium, since it functions as a laxative. Rising levels bring more serious problems. Loss of deep tendon reflexes appears, meaning the knee-jerk response and similar reflexes disappear. Doctors watch for this sign in patients receiving magnesium therapy. Higher levels trigger heart rhythm abnormalities, including SA node blocks, AV node blocks, and various arrhythmias. Respiratory paralysis develops in severe cases, and extremely elevated levels can cause cardiac arrest in diastole. Reassuring data exists about actual occurrence rates. Magnesium toxicity rarely affects otherwise healthy people. A 2021 American Association of Poison Control Centers report documented 2,398 single exposures to magnesium and magnesium salts, most unintentional. Outcomes included 39 moderate cases, 8 major cases, and 0 deaths. The highest risk populations include kidney disease patients taking magnesium-containing medications without monitoring and hospitalized patients receiving intravenous magnesium. Healthy people taking oral supplements face relatively low risk assuming normal kidney function. After all this information, the practical question emerges. What should you actually do? People who don't fall into high-risk categories and experience deficiency symptoms should start by consulting their doctor. Medical professionals can evaluate overall health, check for underlying conditions, and potentially test magnesium levels while understanding the limitations of blood testing. Regardless of supplementation decisions, prioritize getting magnesium from food. This approach carries no risk because magnesium occurring naturally in food and beverages poses no harm and requires no limitation. Healthy kidneys simply excrete any excess. The richest food sources include seeds and nuts. Pumpkin seeds lead the pack at about 156 milligrams per ounce, representing a substantial portion of daily requirements. Chia seeds deliver around 111 milligrams per ounce, and a cup of cooked quinoa provides approximately 118 milligrams. Almonds supply about 80 milligrams per ounce, while cashews contribute around 74 milligrams. Among vegetables, cooked spinach offers the best return at roughly 78 milligrams per half cup. Swiss chard, kale, and other dark leafy greens also provide meaningful amounts. Legumes serve as excellent sources too. Half a cup of boiled black beans contains about 60 milligrams, with edamame, lima beans, and other legumes delivering similar benefits. Whole grains, dark chocolate containing at least 70% cocoa, avocados, and fish like salmon and halibut round out the options. General guidance recommends eating 5 servings of fruits and vegetables daily, at least 3 servings of whole grains, about an ounce or quarter cup of nuts or seeds each day, and a serving of legumes most days of the week. Consistent adherence to this pattern will likely meet magnesium needs without supplementation. For those who choose supplementation with doctor approval, absorption varies between forms. Citrate, glycinate, and malate absorb better than oxide or sulfate. The tolerable upper intake level for supplemental magnesium sits at 350 milligrams from supplements only, separate from food sources. The full picture comes into focus now. Magnesium participates in hundreds of bodily processes, from energy production to heart rhythm regulation to nerve function. Inadequate magnesium leads to muscle cramps, mental health changes, fatigue, irregular heartbeat, and cardiovascular problems. A huge percentage of the population runs short on this mineral. That 48% figure from national survey data raises concerns on its own, and combining widespread deficiency with declining food magnesium content and medications that interfere with absorption reveals a genuine public health issue. But the solution doesn't mean everyone should start taking supplements without thought. Kidney disease, certain heart conditions, myasthenia gravis, or specific medication regimens can turn magnesium supplements harmful. Know your body, understand your risk factors, and make choices based on actual information. Deficiency symptoms deserve attention, but self-treatment without understanding the complete situation creates its own dangers. Consult your doctor and request appropriate testing. Focus on dietary magnesium whenever possible. If supplementation fits your situation, pursue it under guidance with proper monitoring. Magnesium isn't a miracle substance, and it isn't universally safe. For the right person, under the right circumstances, adequate intake genuinely improves health and quality of life. Thanks for watching. Share this with anyone who might benefit from understanding magnesium better, and take care of yourselves.